Between April and May of 2008, a series of unexplained medical emergencies unfolded inside a DaVita dialysis clinic in Lufkin, Texas. Patients, stable when they arrived, began collapsing without warning. 5 lost their lives, 5 more narrowly survived. One constant remained. Nurse Kimberly Saenz was present during every single incident. But at first, no one wanted to believe it. A licensed nurse, a mother, a churchgoer. It wasn't until coworkers caught her red-handed, pulling bleach into a syringe, that the horrifying truth began to surface. Then official documents, clinical records, toxicology reports, and internal staff statements revealing quietly told a different story. Records not easily found, but available to those who know where and how to look. What you're about to see is based entirely on those original materials, legally obtained, line by line, from the case files themselves. They expose a chilling series of events, and the moment investigators realized this wasn't just a medical anomaly. In this video, we take you inside one of the most chilling healthcare homicides in U.S. history. If you value deep dive true crime built on facts, not fluff, subscribe to the Cuffed Report. New cases, raw footage, and the records that reveal what really happened. No speculation required.
Well, let me just put on a minute. Is it Kimberly or Kim or what?
Kim.
Go by
Either
Kim.
way.
Okay. All right, Kim. I'm Corporal Shirley. This is Sergeant Abbott. Work for the Lufkin Police Department. And there's some things that we want to sit down and discuss with you.
Okay.
Like we told you, on the way up here, you're not under arrest. And we get through talking, you're going to be ready to go. And you work at DaVita, right? How long have you worked
there
there?
for 9 months.
9 months. What is what's your job title?
I'm an LPN and I give med nurses. I give meds.
And you're married?
Mm-hmm.
What's your husband's name?
Mark Kevin Saenz.
And you got, how many kids do you have?
2.
2 kids. How old are they?
I have a 16-year-old and a 7-year-old.
Are you from Lufkin area?
Mm-hmm. I grew up in Central all my life.
Okay.
And I went to Angelina Nursing School.
Mm-hmm.
And I went into Woodland Heights Medical Center doing med-surg, and it was just too much for me. And I had a friend of mine that asked me to come, just to see what dialysis was like. And the first, I don't know, 6 or 8 months, it was going fine. And I don't know, these last months, I'm just scared to go to work, to be honest with you, because they can't tell us what's going on, and I'm doing everything by the book, and I'm scared because I have a license, and I'm scared if I do something, then I've lost my license.
Could you elaborate on that a little bit?
Well, okay. Well, when we get there, there's procedures. The past 4 or 5 months, or 3 or 4 months, there's been new procedures. Used to, and it's okay for me to talking to you, right?
Yes,
Okay.
that's fine.
Okay. The last, I've been there 9 months. And when I started, we didn't, wear the gowns, and the mask and everything like that. And certain ways people were taught to be put on, no matter what their blood pressure was, you put them on. And we had a lot of people complaining of chest pain, trying to get fluid off. And so then they decided they would have a nurse that would just go around and monitor blood pressures. And the anxiety in that clinic was just, and I don't know what it is. It's just, and I know we're all new, except for a couple of people. And I'd never done dialysis before in my life. I'd worked at Woodland Heights, and I'd done med-surg. And a friend of mine asked me if I wanted to do dialysis. And I enjoyed it in med-surg, the nursing, when you go through school. And I enjoyed the med-surg. And it took me a little while to do the fistulas and the cannulas. They're not all up here in the ports. And there's certain ways you have to do things. And I have noticed lately that there's been a lot of sloppiness. And that's 6 inches from that person's heart. And I would just like to, if I'm going to put a catheter on, I want to draw all my meds so I know where they're coming from. I don't want to shoot something up there that I don't know what it is, because that's just right there at the heart. And if you do it, then, and they reduced the machines and everything, and it seemed to be going all right, but there's just been bleeding, and I don't know, we keep sending the hospital for breeding, or their access tore, and I don't know if we need a new, my preceptor quit like about 6 months ago, and we don't have a preceptor, so
Okay.
I am scared.
Educate me a little bit. What is a preceptor?
Okay. Well, when I got there, they told me that she had been to classes in Las Vegas, and she was top of her game or whatever. And so they told me I would be with her for 6 weeks, and she would follow me around and make sure everything I did was okay. And because I was nervous, I'd never done this before. But I went to dialysis clinics in my training, and I thought, well, that can't, that seemed, it doesn't seem hard. But the preceptor got fired. So, I don't know if you know all the ifs, ands, and buts about what you can do and dialysis, but you have to have, you get machine ready up, and that takes a good 15 minutes, and you know who your patient is, and you know where your graft is, and you get it all ready. And the dialyzer, it has Renalin in it, and it's got to be circulated, because if they get a renal infusion, well, then they're also to the hospital, it's like bleach. So we had that, and then we just had so many chest pains that I just don't understand. And they said that we've had so many deaths in the past 7 months. I mean, April, and it's just scary, and I'm scared to leave my patients. You know, I'm just constantly, are you okay? Are you okay? Are you okay? And so I'm really not sure what to do about it. I enjoy my job, and I only know I've been here 9 months, but you know, you either hate it or you like it. So, and if I can get, I have good patients that they come on, they're cheerful, they know they're here. They know they're here for, you know, we're just trying to help them feel better. And it makes you feel better at the end of the day. But when you have codes after codes, it's just frustrating. And you're like, you lose your mindset of like, okay, where am I? Where do I group at? So, and I really thought that dialysis was what I wanted to do. But I don't know what's going on. I don't know if it's in the water system. I don't know if it's in.
Have they been checking all that?
Yeah, that's what they said. But I know that every day they have to do a police loop through the whole thing. And I'm just curious, what if our machines are hooked up and they have some bleach in them? I haven't researched into that, but I just have to wonder what kind of reactions would have happened if there was some machines, some bleach machines, not clear. I know we bleach them every week.
What do you mean you bleach them every week?
But on Thursdays, all the machines have to be hooked up to this big bleach bottle, and they have to go through, and they have to go for like 25 minutes. And when it's done, you take your bleach bottle out of it. And to me, when I get there in the morning, if I know it's Thursdays or bleach days. So when I get there in the morning, I just check, there's a little, spout thing. And you can spout it and check for chlorine. Because I just don't.
You just don't think they'd got it out?
Well, I don't know. I just don't. I know they bleach the route of they bleach the loop. Mm-hmm. And maybe that comes all out. I don't know. I just have a habit of pushing the bleach because I don't know when it was last done, and I don't want to kill my patients.
You mean pushing the bleach?
The bleach?
Yeah.
And they put it in after the patients are gone, they're in these little Tyler cylinders. And you go back to your main screen, you go chemical, bleach. And it'll go through about 35 minutes. And then there's a little drain thing on the side. You're supposed to squirt it for like a couple minutes, get your little bleach thing, and make sure there's no bleach in there. You're supposed to have 2 people do it, just so you know there's no bleach in there.
Right.
And it seems like, and then it might not be my place to say, but we had 32 chairs, I believe, and it doesn't seem like there's a lot of people watching. I sit by my patients because I'm scared. I don't want my patients to go out. And it's my license on the line. It's not just a PCT. I have.
When you first started working there
Mm-hmm.
9 months ago, what kind of training did you get?
First of all, they set me up on the machines, show me how to do those. Then they show me how to do preparing for the machines, and then they the grafts I could do, the catheters I could do. The fistulas I had a little bit of problem with, but that's just because I've never been on dialysis before. But I thought I was getting better. And the only thing that I noticed, and this is not to be a tattletale or nothing like that, but there's certain ways to take your needles out, and that little thumb thing, if you'll pull it all the way, if you'll pull it the right way, then there won't be any pressure on there, and it won't tore their arterial or venous line. But I have seen patients, just gauze it and then yank it, keeping pressure on it. So, and I don't know if that has anything to do with arterial, bleeding. I don't know. It's just for freezing, because it's just I just don't know. I feel like I'm doing everything in the power I can. And I've been looking up on the interline, like, what am I doing wrong? And I'm just flabbergasted.
What you're doing wrong?
Huh?
What you're doing wrong?
I have noticed, I was pointed out today, and I write them down. Miss Giselle, she showed me, which my preceptor had showed me. My preceptor had showed me, like, you get your fistulas, and you go in, and as you go in, you turn them, which I didn't know not to do. And I had no idea not to turn them. But after she explained to me what that did, it's just a bad habit. I'm going to have to get out of breaking that. So,
when was the last time you were at work?
Tuesday. Or what's today? All right. Monday. Today's Tuesday.
Tuesday.
Today's Tuesday?
Yeah.
Okay. Mine's are all running together. Okay, Tuesday, yeah.
Okay, so the last time you were at work was what day?
Monday. No, Monday was my last day at work. I can't remember it on my schedule.
Okay. That was yesterday, right?
Yes. Right? My days are all screwed up. Yes, Monday. I do remember it being Monday.
Okay. Did anything happen yesterday out of the ordinary?
The only thing I noticed, like on my side and Christy's side, Miss Roan's venous chamber was cutting off. It had big cuts in it. And I asked her if she felt okay. She said okay. So I gave her a little bit of saline and tried to get that. It was like a monstrous cut in there. I don't know if it had to do with our changes of our heparins, or because we did change our heparins. And that went in, let's see. Tomorrow didn't seem to be an interview,
What were you assigned to work yesterday?
I was assigned to work as a med surge,
Mm-hmm.
but when Tammy Watts didn't come in, she had 4 shifts to patients, 4, yeah. She had 4 shifts. So I picked up her shifts.
Okay. What did that mean when you picked up her shifts? What did that change your responsibilities to me?
Well, I couldn't do any meds. And since they decreased their the bolus, the infusion was like five, so we just kind of every time we did a vital sign, we had to add a little bit more saline to keep it from clotting. I noticed.
You keep saying you added saline. What do you mean?
I'm sorry.
You keep saying you added saline.
Oh, well, like when we did their vital signs, we just put like a tiny bit, like 50 cc's, just enough to get that venous chamber. Because we didn't load them up with that Heparin. Sandy gave the heparin and the boluses, and that kind of slowed things down a bit, but that's all. I mean, that's all we did.
Are they on the saline bag or what? Okay.
Yeah. And she just said she didn't feel. She came in at 6 kilos and blood pressure wasn't any good. And I put the charge nurse. I tried to get 4, but her blood pressure wasn't any good. And I didn't want her to go down on me. And I gave her a little bit of pressure. And I gave Miss Berlin to get a little bit of pressure. Which I took really. Sorry.
What do you mean you gave a little bit of pressure?
Hmm.
You said you gave him a little bit of pressure. How do you give him a little bit of pressure?
Give more pressure.
You said you gave him a little bit more pressure a minute ago. Miss Arlene and Miss Rome.
Mm-hmm.
What does that mean?
I just readjusted your pressure because sometimes.
Pressed her. I'm sorry, I misunderstood. Pressed her.
Sometimes when they halfway through treatment, the fluid. So I readjusted her her blood pressure kit.
Okay. Did you, other than the saline bag, did you give her anything else?
Miss Hall.
Miss Rome?
Oh no. Mm-mm. That's what I was so frustrated about last night. Because Bill was given all the medications and hers was starting to clot off. Which we had decreased her dose range, and her venous pressure kept going off. So the only thing I did was flip this line, and but no, and her venous pressure looked like it was completely totally clogged off. And so the only thing I did, and I charted over there, was give her some saline because that venous chamber looks like it had clots all in it.
Did Miss Bryant say anything? Was she conscious at this point?
Yeah, she was.
Was she wondering what was going on? Or?
Not really. I walked up and asked her, well, I think you might be trying to clot off again. I'm going to go ahead and try to return your blood. And I just gathered her hooked to the saline line to start returning it. And within just a few seconds of me starting the machine back to going again, she asked me, well, what are you giving me?
And what'd you
I
tell
told her, I said, you said that I'm giving your blood back to you. And she turned her head to the side and coded.
How'd you give her saline?
I opened up her saline port, and then I clamped that arterial, I believe that's coming from, with a clamp, just so I could see, how many clots she had in there. because it was like going 300, 340, and I was scared she's going to clot off. I would have to get a new dialyzer.
Kim, do you have any type of medical problems yourself?
No, I do take depression once a day.
Mm-hmm.
I take some Malta once a day.
Subaltern.
Uh-huh. They put me on that 6 weeks ago.
Sure. Do you take any other medication or anything?
Mm-mm.
Does the Cymbalta affect you at all?
No, in fact, he started me on 60. In a couple of days, it was kind of like I felt mania. Just, I don't know. Just my mind was racing and all that kind of stuff. So I went back to him and he lowered my dose to Cymbalta. And so far, so good, hopefully. But what hurts me the most is for two patients to accuse me of giving another patient's medication that was not ordered. And that's been something that's really irritating all day. I was just crying earlier, and I was like, I mean, it's my license. If I do something like that, I can't do something like that.
What did you give her any medicine?
I did give her some saline, only because she said she was cramping. Opened her saline line, Angie wasn't there. So I charted that I gave her some saline line. Her pressure didn't really go down that much. And then she just said she felt kind of nauseated.
Which patient are we talking about?
Wrong.
Miss Rose?
Mm-hmm.
Yeah. Did you attend any other patients yesterday?
I had Miss Hall and Miss Hamilton and Miss Womack. And I had, who was the other one? Miss Gail Owen, that's what he was.
Okay. Did you ever have more than one of these at a time going? Maybe two at one time going? Or was it all you doing one patient, then wait until that one was through and doing it?
Yeah, the way it ended up in that section, I had 10, 15 minutes to get off. I think Miss Hall's first, and then Miss Womack. So it actually played out pretty good. They had a good 15 minutes in between.
Did you work the whole day yesterday?
No, because what happened, and I'm really been upset about this, Miss Hall, she claims that I gave Miss Rome some medication. And she didn't want me to do anything to me today. And the only thing that I did was go over there and give her saline. And I know you're supposed to stay with your own 4 patients. And Angie was gone. And she was just up moaning and groaning. Her blood pressure was down. So I gave her a little bit of saline and I traded it. I charted it. And she just said, Miss Call said, what did you give to her? And I said, I didn't give anything to her. I gave her saline. Her blood pressure's dropping. And then it wasn't long. She had Miss Hamilton sitting right beside her. And she was like, did you see her give her something? And it was it was very frustrating because I wanted to go back to them too and say, what did you give? What did you see me give? Because all I did yesterday was get my patient set up, delved into the meds. I didn't do any meds. And I guess my patient, they come here and they want to be dialyzed and they want to get out. And I don't know what's going on here. And it's just scary. And if I'm doing something wrong, I want to know that I'm doing something wrong because I don't want to kill somebody. I mean, I know it's dialysis. It happens all over the country. I just don't understand what's going on.
What do you mean it's dialysis? It happens all over the country.
Well, I guess maybe not all over the country, but there's, Amy told me the other day, she goes, girls, this is dialysis. There's so many places around here, and it goes smooth. So I wonder, what are we doing wrong?
Mm-hmm. Well, then a couple of weeks ago, they brought in people to sit and watch and monitor each person while they were working. And you had somebody watching you during that time. How did you do them?
She said I did excellent. That was Miss, well, I can't remember her. I couldn't see her because she stood right behind me. She said I had good techniques, which makes me feel better. I'm just frustrated because I don't know what I'm doing. That's where I am.
Can you tell us anything about the bleaching procedures?
Bleaching procedures. We are supposed to, after we get our, well, some people do it before you get your, there's two things in bleach back there, and it's either before or after. But you have to get your bleach bowl, and you have to get like a little medicine cup. And you got to go all the way back there, and you got to get that. And you pour it in your bowl. And that's your sponges to wipe up. Mm-hmm. And some cleaners, some people do the clean. So I'd ask Angie, I said, you know, will you go get my clamps? Nobody left me in the clamps before. They were all just kind of hanging up there. And so when she went back there, she got me some clamps. And I just poured them all off of there. And I don't know if it was just the complete anxiety, which is that's what Tammy told me. But it's just very frustrating because I've been here 9 months and I think I know what to do. But I sure as heck don't want lives hanging on my shoulders and my license.
Okay. Would there be a cause or a reason or necessity or anything like that for anyone to use a syringe to draw bleach up into?
No. There should be 2 of the 2 cc's up there. And if there's not any, you could draw.
Miss Reynolds said, you know, I cannot believe what I just saw. And I said, well, what, you know, tell me what you saw earlier, what's going on. And she's like, I saw that nurse over there, you know, the one with the ponytail, the one, Kim. I said, yes, Miss Kim, the LVN. She says, yes. She goes, I saw her draw up some of that Clorox. She kept insisting that it was Clorox. I saw her drop that Clorox and she went and injected it in that patient over there. And Miss Roan, I said, which one? And she said, Miss Roan's chair, you know, she got sick a while ago too. And it wasn't long after she injected that. And I said, okay. And she said, and then she went and she put it in that sharps container over there about the patient on the end. She didn't bring it, you know, and she walked over there and then she came back over here and she kept really looking around, acting like she was real nervous. And she didn't bring it over here, but she walked way back over there and put the needle in that container. I said, okay, we're going to be okay. You're going to be okay. She will not come take you off. I'll get someone else over here to take over this room. I said, are you okay? Yes, ma'am, I'm okay. It's all right. So then I wheeled over and I talked to Linda Hall. Miss Hall, what's going on? What can I do? You know, I understand you're upset. And she basically gave me the same story about Kim having a bleach container on the floor, and that Kim drew up bleach from that container and stood up with the syringe right by her side and just kept looking around, watching. And I said, well, what was she watching for? And she's like, because she's just curious. And she's like, well, she was waiting for Dale, who was my med nurse that day, to walk back from where he was at with Arlene, who was monitoring him. When he had left that area, that's when she had walked over to Miss Rome's area and actually had infused what she felt was bleach into the lines of the patient. And she gave the exact same story about how she came back over and was still hiding the syringe by her side, and then how she later had gone and disposed of the syringe in the sharps containment. There was another syringe that was actually had a needle attached to it, which was very odd and different, and had the cap on it. I removed the cap and
Now, did Miss Manhano subsequently, she went to the hospital, right? From,
Yes, we sent her to the hospital.
who makes that call? Whether or not she needs to go, or whether that's the best interest or what?
We get a hold of the doctor and get his advice. Otherwise, the FA, or if the FA's not there, the charge nurse, you know, whoever's next to authority.
So, do you remember who made that on this stuff?
No, I don't.
But it was based,
It was based on her, on what she was experiencing, what she was saying.
what did she tell you she was experiencing?
She said that her mouth became numb and tingly. She started getting sick to her stomach, started vomiting. Her blood pressure, according to this chart, never dropped low. Not even for her.
Right.
So whenever she started, she appeared to be in an anxiety attack.
By that, what do you mean it appeared?
Anxious, getting hot, nervous, breathing a little bit faster, her heart rate was going up, and it was very hard to get a good strip on her. She was moving around a lot. It was showing
It's true, like an engagement.
ECG, yeah. It was showing tachycardia, which just means that her heart rate was over 100.
Is it normal for patients who are receiving dialysis to have numbness and tingling in the mouth?
No.
Being a nurse, what would that indicate to you?
It could indicate a allergic reaction to something, irritant.
A lot of things it could be, but
Yes,
it's not a normal
it's not normal.
force for dialysis. It's not normal for a person to experience that.
No. She was concerned about her access because she had had several bleeding episodes after treatment recently before this.
Did y'all take any steps to address that? By that, I mean,
Well, I know that there was, we had mentioned to Dr. Zero before that they may need to go in and look at her access. I do not know if that was actually
right.
done. That would be one of the things that they would do, is do a venogram and see if there was something causing that. The other part is educating whoever was pulling her needles how to do it properly with it so that it would not tear.
Did a LPN or RN always cannulate her, or was she the patient care too?
She actually cannulated herself.
Okay.
The thing that someone would have to kind of help her get it in the right area because her eyesight wasn't the greatest. And generally, if I was there, I would, because she trusted me. But it just kind of depends.
On that day, if she self-cannulated her, or somebody else?
She cannulated herself.
By treatment, I guess, did y'all adjust your treatment anyways to try to reduce the bleeding, i.e., cutting heparin or increasing the?
Her heparin had already been adjusted pretty low, to 500 units an hour, and stopping in 2 hours. So if she ran her full 4-hour treatment, it would shut off after 2 hours. Well, in this case, since she was only running 3 hours, it would have shut off after an hour on the machine.
Is that a self-program thing as part of the pump?
That is something that is programmed by the tech.
Check on that day.
Orlin was.
And what? It's time for the candidness. What was your opinion of Workman as a tech?
He was good. And he would come to me with any problem with the patient, or if he had a question that he wanted to clarify about whether or not he should inform me, he'd come and talk to me. He's like, look, this is going on. And I was like, okay, this is what we're going to do. He was very good.
So he was very confident.
He was confident in some areas. In some areas, he needed to grow a little bit more.
What areas were those?
Some of it's just how to deal with some of the patients, how to address some of the situations that would come up.
You mean more like personality versus technical skills?
It's just, in his technical skills.
What type of things that come up?
He would, I would tell him, these are the things that I want you to come to me for. If their pulse is out of this range, if their blood pressure is out of this range, if you feel like there's something going on that needs to be brought to my attention, come to me. He would. He was very good about that. He had problems cannulating, of course I do too, but some of it I would just help him with it, show him and work with him on the ones that I knew that I could get, and the ones that I knew I had problems with or couldn't get. I was like, you need to go get so and so to help me with this one.
As far as running the machine or setting up the
He-
things?
He did it good. If he had questions, he'd ask and I'd help him. I do that for anybody.
At what point did you become involved with Miss Oates on that day?
About 9:45, she started complaining about nausea. Of course, her blood pressure dropped pretty significant. I was checking on her, talking with her. And then just keeping an eye on her. Of course, she is a patient that I would talk to on a fairly regular basis throughout her treatment. At about 10:40, she said that she wasn't feeling good again. Her blood pressure had dropped out pretty significant. And I addressed that,
How did you address that?
giving her saline, turning her UF off, treating the hypotension.
That was chartered, correct?
Yes.
Any theories or why her blood pressure would drop so low so quick?
Miss Oates, since the first of the year, started having problems and went to a cardiologist and discovered that one of her coronary arteries was partially blocked. Wasn't enough to overly affect her, but it was enough to make a difference in dialysis, and she was under the care of her cardiologist dealing with that. They hadn't opted for surgery at the time.
So was it common for her blood pressure to drop during dialysis?
after a certain point, after the first of the year, it did start noticeably on a regular basis during treatment drop. And she would say, I'm not feeling good.
You can draw your TCC up there and shoot it into your, you only get 10 cc's, for your bleach solution. So you could call it up there. And that's what I did. I just go up there and put my 10 cc's in there. And then I put my washcloths in there.
Okay. You put your 10 cc's of bleach
Mm-hmm.
in what?
They're in a plastic, I don't know, I guess they're about like this.
Mm-hmm.
Then you put your rags in them. And then you put a top of it, top of them. And they should be 1 to 100. Like, you take a little 1 to 100 cap, you pour it in there, and then you pour water. There'll be a 1 to 1,000 mark. You pour your water up to that. And then you just put your cloths in there and close it. And so when your patient shift goes off, you clean them all off. Now the clean clamps, that's something new. But your clean clamps are supposed to be on the other side with a 1 to 10 bleach and let it sit there in case bleach gets on the bleach that were on the machines.
Okay. I'm a little bit confused, so maybe you can help clarify this. Do you use a syringe to pull your 10 cc's of bleach up?
Sometimes I do when I can't find the little medicines cups.
Mm-hmm.
They used to be in that truck drawer. There wasn't any in there. So I knew 10 C's would make that. But I did it at the back.
Mhm.
I did it at the back where there was blood. Because we weren't supposed to do it up here. And you just get a little 2 ml cup. You fill it with bleach, and then you put 1/1000 bleach in there, and then you put your clean clamps in there.
When you use a syringe to draw up the bleach, so before you make your mixture up, what happens to that syringe?
If you use a syringe, they actually have little cups to monitor them. There wasn't any cups up there that day, but if you use a syringe, 10 cc's, then you're gonna have to, put it in the receptacle.
Okay. Did you do that yesterday at all? Did you draw any bleach up in a syringe?
I drew, I had 2 that I went back there for. And I put the 2 LM in the bleach. And then I took another one up there that said clean clamp. I put it there. I put the 2 MLs, whatever, in there. And I set the clamp. And I set my bleach. So then I put my rags in my bleach. And I put my clean clamps in there. Just something I'm trying to get used to too.
Okay. You used a syringe with the bleach in there?
With your water.
With my water?
Yeah.
You mean on the clean bleach?
Yeah.
Mm-hmm.
See, I didn't have those 2 mLs.
Mhm.
So I went to the back and I got a cheap, I got a 10 cc syringe because I couldn't find any more of those little yellow things. And I pulled up my 10 cc syringe and I dumped it out. And I discarded the 10cc syringe because we were out of those little cuppy things.
How many times, how many different syringes did you use? Did you use one for both solutions, or, you know what I'm saying? Did you draw your bleach up, put it in the solution, draw more bleach up in the same syringe, and put it in the other, in your clamp clean cup?
No, I had two. And then we have, okay, on our bleach stands, we have these little medicine cups. And I poured that much in there, and I turned it off. And then I took that back over there so I wouldn't spill the bleach, and I put it in the sink. And I put all that in there. And then on clean clamps, I took back over there, and there was no 10C little, what a medicine cup. So I took my bleach and I just poured it in there, and then I pulled up to the 10C because I knew that would be like 10 ml. And I squirted it in there, and then I took it, and then I put my syringe. I don't know if I'm not sure where I put my syringe, honestly.
Okay. Were you near any patients when all this happened?
They were on the machines.
Okay. Where were you at?
I was, I was right here. There was 1, 2, 3, 4 patients here. And I told Angie Angie had these 4. I told Angie I had to go get some bleach for the cloths. So I went back here, I got it real quick. It didn't take very long. And I put it right there. And I asked Angie, I said, what do we do with these clamps? She said, just go and get some bleach, the 10 to 10, and put them in there. So I walked right back here real quick, and I gave them, there wasn't like a little thing, so I grabbed a syringe out of the med cabinet, and I drew up that syringe. And then I just put it in there for the clean clamps.
You put what was in the syringe in. You put what was in the syringe in what? In the machine?
No, in the clean clamps, they put out a new clean clamps that once you're done with your patients, you've got to take all your clean clamps, put them in there and let them sew.
Mm-hmm. Okay. Did you ever go over to any patients with any syringes in your hands?
No,
While you were adjusting the saline over there, just checking on them or anything like that, did you ever have any syringes in your hand? Or
no, because I wasn't doing meds that day. And I know when Angie left to go on break, Miss Rones and Miss Dickerson, they were right there. The arterial pressure kept coming out, and the venous kept, and it should like she had a clot in there, but that was because we wasn't using musclots at all. And so I rinsed some saline into Miss Rones to see, maybe it was just clotting off because the pressures were high. And then Miss Dickerson, she said she was cramping, so I gave her a little bit. And then the only thing is, I was trying to chart on my patients, and Mr. Reisinger, he called me over there and he said, will you come take her off? I wasn't her, teammate, but she gets mad. He gets mad when she's not with certain people. And so she had said she had started having chest pains. So it's just been really frustrating.
well, we're all trying to figure out, why there's been this sudden spike in events uh, over the past month or so. Do you have any theories or any ideas what's causing all this?
Well, I know I'm new. I've only been here 8 months. But I just wonder about the blood pressures, when they come in and they're really high. Um, and I get so scared they're going to stroke out. And it's just scary. I didn't know dialysis was going to be like this. The first few weeks, it seemed to go okay. You might have a bleeder or two, but having triage every day, it's just, and when I keep going over and over in my head, my books, and trying to figure out what have I done wrong.
Have you been working on a lot of these people that have had problems?
Let's see. Miss Strength was the first one. And let's see. I was doing CPR on her.
Now, one of the things I want you to, I could tell by the look on your face that you were a little bit, you saw something on there that didn't look right or something, but before we get into all this, Kim has had some charges filed on her. And we wouldn't be able to file those charges if we didn't feel like we had the evidence to back them up.
Correct.
Okay, I'm not asking you to pass any judgment on Kim. Okay, I understand that. But if there's something on these charts, well, it looks like Kim was the one that lowered the BFR. I mean, you don't see any reason why that would need to be done?
No, because of
All the pressures look
all
good.
the pressure. Kim, we got along pretty good. She liked me helping her out and stuff, and she was like I guess she was on my side several times. And if she did put bleach in those syringes, man, I didn't see it. You know what I'm saying? I mean, unless she went off and probably put it in her pocket or something. I don't know, man. But to me, she didn't seem like the type of person, that would actually do something like that intentionally. But it's still a no-no to charge, putting bleach in bloodlines and all that. That's somebody's life.
Mm-hmm. Well, I think it's all gonna come out in the end.
Be called in court.
Well, you may be.
Testify.
It's not gonna, shoot, everybody's probably gonna be called into court at some point in time.
Cause I'm trying to get my job offshore, I'm trying to make a move. I gotta do something, man. I don't know if I'm gonna get my unemployment or not, so I'm still working on it.
Yeah. Well, is there anything else that I hadn't asked you about that you feel like I need to know about, or just anything else you want to say that you feel like we need to know? Something, just anything.
I guess, I did not find this out until I was in class, after all this went down, where they putting people on profiles, sodium profiles, and stuff like that. And if you're not a doctor, you aren't supposed to do that. That's like changing the doctor's orders or something like that. I used to see teammates do that, setting the profiles, sodium profile. I don't know if they wasn't aware of it or because I did not know how to do it, so I never, just with all this going down, man. So, man, there was a lot of things going, some things that we ain't supposed to do. You know what I'm saying? doing it the DeVita way, or, you know, I don't know. I don't know, we weren't just properly trained right, or what.
You say teammates were setting,
When I say teammate, that can be from patient care tech, LVN, RN. That's what I mean. But if you're not a doctor, if the doctor did not do that, that's like you overriding the doctor's, you know, prescription of the patient. That's true.
okay, anything else?
Can't think of nothing off my head like to help you out, man.
Well, you got my number?
No.
Okay. My cards.
Okay.
You think of something later,
Okay.
you know, something pops in your head that you think we need to know about.
Like what? I mean,
I mean, anything.
worry about Kim or something. Or,
Yeah. I mean,
I
just,
just heard she was in New Jersey. Now that's what I heard. So, watch me.
yeah. You know what she was doing up there?
No, matter of fact, this is how I found out. I was looking for another job, and I know teammates that used to work for DeVita. She transferred back to a Beaumont clinic, and they were making pretty good money. So,
Stephanie?
not Stephanie. I think it was Connie. So I talked to Connie, and Stephanie called me, and she said, "Well, come down here and fill out the application and stuff." And she said, "What's going on down here?" And I said, "Well, I can't talk about it." And stuff. She was telling me, "Well, I talk to Kim from time to time," and I said, "Oh, she's in New Jersey." I ain't say nothing. So she was telling me that her boyfriend, he works at a refinery down there. Come down, you know, get application. That's about it. That's all. That's how I found out.
Yeah, we've heard that as well.
Yeah. So
I hadn't really been able to confirm.
I seen her several times reading the Bible, you know, reading spiritual books. You know, she talked about her church she go to, and talked about her husband, you know, about sports, you know, sports. I used to work I'm a Kansas City Chiefs fan, and, you know, she said, "Well, what should I get my husband for, you know, for Christmas?" I said, "Do we like sports?" Yeah, he like the coach in that because maybe you need to give him like a jersey, a Peyton Manning jersey, you know, stuff like that. But you know, everybody got problems, you know, might not be as severe as the other person, you know. She didn't seem like a bad person to me. Very, very kind hearted, you know.
And let's see, Mr. Kelly, I was done CPR. Yeah. I was on my bed. Miss Castaneda, she wasn't on my bed, but we kind of needed everybody. It just makes you think. It's so hard because you think, what am I doing? Mom.
You want to just turn that off?
Yeah, she did.
Is that your husband or somebody?
My son.
I'm gonna step outside. Just a second.
Hello. Yeah. Well, I'm on board. You'll come get me. Who?
Okay. Kim, I think that's about all we're gonna need.
Kimberly Saenz was a nurse entrusted with lives, but within months her patients were dying in alarming numbers. As she sat across from detectives, no charges were filed, no arrest was made. She spoke freely, nervously, desperately. She talked of bleach, of syringes, of fear. But behind the nurse's explanations were mounting contradictions. Patients coded, witnesses watched, and Kim denied responsibility. In 2012, Kimberly Saenz was convicted of 5 counts of murder and sentenced to life in prison without the possibility of parole. But in this room, before the verdict, before the sentence, all we had was a story. Was it the truth? Or a last-ditch attempt to control the narrative? Want more unfiltered interrogations, psychological breakdowns, and legal deep dives? Subscribe to The Cuffed Report, where we don't just tell the story, we dissect it. And let us know in the comments, do you think Kimberly Saenz was already guilty in that chair?